Today I am reading the medicine Carcinocinum, wonderful miasmatic medicine from the soul of remedy, book written by Dr. Rajan Sankaran. Carcinocinum is prepared from the cancerous breast tissue. It represents the very center of the cancer miasm, which falls between the miasm psychotic and syphilitic. The main feeling amongst remedy and person of the cancer miasm is that one's survival depends on the performing task which one feel incapable of performing. There is a need to be something that is almost beyond one's capacity. The patients stretch themselves to the utmost in the hope of success. Because of them, failure means death and destruction. This miasm therefore has the psychotic fixity as well as the destructive dimension of the syphilis. Carcinocinum people often have a history of taking on too much at a young age, having too many expectations placed on them, too strict parental control. They try to live up to these expectations and make a tremendous effort to perform exceedingly well. They set for themselves a high standard or goal that are near impossible to achieve and drive themselves to try and accomplish them. In that sense, they reach out for the perfections and almost finish themselves in doing such things. So, the cancer miasm has this theme of superhuman effort in order to survive. The need for control over oneself and over one's surrounding is tremendous, as is the need to keep order in the midst of the chaos. The disease cancer itself represents the breakdown of all control mechanism within the body, which chaotic behavior of the cells. The feeling of a cancer miasm person is like that of the physician who is trying to bring order and control over the disease cancer. He knows that it is very difficult job with very little chances of success. Yet he has to try with some hope of success. The cancer patient runs from the pillar to post seeking relief, and when all fails, give up with the absolute despair characteristic of the syphilitic miasm. It is a continuous and prolonged struggle which seems have no end. The need for perfection makes Carcinocinum person sensitive to reprimand and fastidious in every sphere of life to the point of being faultless. But unlike Mendel's remedy, which merely wants order in everything that they do, Carcinocinum patients often shows an interest towards artistic things like music, dancing, and painting. They are sensitive to and enjoy beautiful scenery, seesaw, thunderstorm, and lightning. They show the sensitivity of the plant as well uh, as well in that of found in Pulsatilla and Ignatia. They are sensitive to reprimand and are offended easily. They can also be sympathetic, very warm and human like the phosphorus. But they are all the time striving for perfections. To be the perfect partner, the perfect one for the job, the perfect parents, etc. So they are often ideal for others. Out of this need to be perfect arise an anticipatory anxiety. If they organize a party, it is not enough that the party should get going. Rather, that everything should be perfect. Neatness and cleanliness simply are not good enough for them. They must be perfect. The furniture should be blend with the surrounding. Everything should match, etc. They are well dressed people with good taste. Carcinocinum children are well mannered and well behaved. They can become neurotic about perfection, and sometimes this can be so extreme that they become a suicidal. There is also tendency to suppress, like Ignatia. They accept their disappointment and also their domination with kind of resignations and tend to accumulate all the grief within without expressing their sensitivity. They have the tremendous anxiety about the health and great fear of disease, especially of cancer. Carcinocinum patient shows a variety of cravings, for example, for eggs, milks, but they especially crave for chocolates. They often lie on the abdomen during the sleep, have bluish stains on their sclera, and also the mole on the skin. They are emerged at seashore and by thunderstorm and lightning. A history of infectious diseases like tuberculosis, mumps, measles, chickenpox, malaria, typhoid may be the present, and history of cancer in the patients of the or in his immediate family member could be the additional confirmation for the carcinocinum patient. Rubrics are sensitive to reprimand, offend easily, take everything on bad part, fastidious, element from anticipation, dancing, sympathy, compassion, suicidal, consolation kind words, aggravates. This is all about carcinocinum. Thank you.